Hi, my name is Shiver Olero, and my presentation is about food addiction. So let's get it started. So, what is food addiction? It involves binge eating behavior, cravings, and a lack of control around foods. According to Gunners, in 2018 article, common symptoms include getting a craving to eat something despite being full, eating more than intended, eating until feeling excessively stuffed, feeling guilty afterwards but will do it again soon, making up excuses in your head, repeated failures at setting up rules for self, hiding eating habits from those around you, unable to let go of excessive eating despite physical problems and harm to body. Also, according to Zuden and Fletcher, food addiction is similar to substance addictions rather than behavioral addictions like pathological gambling in that there is an there is an agent that has neurochemical effects in the brain. Additional signs and symptoms: gorging in more food than one can physically tolerate, eating to the point of feeling ill, going out of your way to obtain certain foods, continuing to eat certain foods even if no longer hungry, eating in secret or isolation, avoiding social interactions, relationships, or function to spend time eating certain foods, difficulty function in a career or job due to diseased efficiency, spending significant amount of money on buying certain foods or binging purposes, decreased energy, chronic fatigue, difficulty concentrating, sleep disorders such as insomnia or oversleeping. Also includes restlessness, irritability, headaches, digestive disorders, and suicidal ideations. Food addiction is like the culmination of several factors that interplay in the overall cause of this disorder. A man or woman may develop an addiction as a result of biological, psychological, or social reasons. Biological causes that may influence the progression of a food addiction might include hormonal imbalances, abnormalities in various brain structures, side effects from the use of certain medications, or having family members with this type of addiction issues. Pharmacological considerations. I'm sorry. Frequency or pattern of use. According to WebMD, like addictive drugs, highly palatable foods trigger feel good brain chemicals such as dopamine. Once people experience pleasure associated with increased dopamine transmission in the brain's reward pathway from eating certain foods, they quickly feel the need to eat again. Method of administration. So there's binge eating. This condition is classified as an eating disorder in the DSM 5 or DSM 4 and is characterized by recurrent episodes binges of uncontrolled, often rapid consumption of large amounts of food, usually in isolation, even in the absence of hunger. This eating persists despite physical discomfort, and binges are associated with marked distress and feelings of guilt and disgust. Binges can be triggered by negative mood states, which are not necessarily ameliorated by the binge. Physiological aspect. According to WebMD, experiments in animals and humans show that for some people, the same reward and pleasure centers of the brain that are triggered by addictive drugs like cocaine, heroin are also activated by food, especially highly palatable foods. Highly palatable foods are rich in sugar, fat, and salt. Absorption process of food. People who show signs of food addiction may also develop a kind of tolerance to food. They eat more and more, and only to find food satisfies them less and less. Process of food digestion. So first it goes through your mouth. Food starts to move through your GI tract when you eat. When you swallow, your tongue pushes the food into your throat. A small flap of tissue called the epiglottis folds over your windpipe to prevent choking, and the food passes into your esophagus. Once you begin swallowing, the process becomes automatic. Your brain signals the muscles of the esophagus, and peristalsis begins. Next is lower esophageal sphincter. When food reaches the end of your esophagus, a ring-like muscle called the lower esophageal sphincter relaxes and lets food pass into your stomach. This sphincter usually stays closed to keep what's in your stomach from flowing back into your esophagus. Next is stomach. After food enters your stomach, the stomach muscles mix the food and liquid with digestive juices. The stomach slowly empties its contents, called chyme, into your small intestine. Your small intestine, the muscles of the small intestine mix food and digestive juices from the pancreas, liver, and intestine and push the mixture forward for further digestion. The walls of the small intestine absorb water and the digested ingredients into your bloodstream. As peristalsis continues, the waste products of the digestive process move into the large intestine. The large intestine waste products from the digestive process include undigested parts of food, fluid, and other cells from the lining of your GI tract. The large intestine absorbs water and changes the waste from liquid into stool. Peristalsis helps move the stool into your rectum. Lastly, we have the rectum. The lower end of your large intestine, the rectum stores stool until it pushes stool out of your anus during a bowel movement. Some physical effects of food addiction include heart disease, diabetes, digestive problems, malnutrition, obesity, chronic fatigue, chronic pain, sleep disorders, reduced sex drive, headaches, lethargy, arthritis, stroke, kidney, liver disease, and osteoporosis. Physiological effects: low self-esteem, depression, panic attacks, increased feelings of anxiety, feeling sad, hopeless, or in despair, increased irritability, especially if access to desired food is restricted, emotional detachment or numbness, and sadly, suicidal ideation. Impact on social life and relationships include decreased performance at work or school, isolation from loved ones, division within family units, lack of enjoyment in hobbies or activities once enjoyed, avoidance of social events or functions, risk of jeopardizing finances or career. And lastly, some treatments include groups such as Food Addicts Anonymous, Overeaters Anonymous, and Food Addicts in Recovery Anonymous exist for people looking for a 12-step program. These groups provide physical, emotional, and spiritual aspects, offering much needed support to individuals seeking to heal from their addiction to food. And these are my references. Thank you.